National Capital Region, Laguna Province, and Cebu City will wake up to a modified enhanced community quarantine beginning May 16. Employees in government offices may expect one of 4 work arrangements when your work resumes next week. A lady senator calls on companies and government agencies to maximize the work-from-home scheme. The World Health Organization warns against using herd immunity to combat COVID-19. The Hong Kong government appeals to underage persons to stay away from high-risk protests. And the World Health Organization stages its inaugural Health for All Film Festival Awards ceremony online today.
Residents in Metro Manila, Laguna Province, and Cebu City may expect a modified enhanced community quarantine or MECQ scenario 4 days from now and onwards. This is because President Rodrigo Duterte has approved the Interagency Task Force against COVID-19 recommendation to continue the quarantine restrictions in some part of the country. Rosalie Cos monitored the residents' meeting with the IATF and these speeches. It's still an ECQ, Malacanang said, but various industries are allowed to reopen. Rosalie Cos tells us why.
From May 16 to 31, 2020, Metro Manila, Laguna, and Cebu City will wake up to MECQ or Modified Enhanced Community Quarantine.
So ano po ang ibig sabihin ng modified? Ang modified po na ECQ is ECQ. Kaya lang, merong ilang industriya na bubuksan.
Under MECQ, the movement for obtaining essential services and work remain to be limited. Some industries, however, will be allowed to reopen but with a maximum of 50% workforce. Even transport services are still limited. Physical classes suspended still. The palace clarifies that some parts of MECQ areas may be placed under ECQ or lockdown, especially in critical and containment zones with a high number of COVID-19 positives.
Yung mga lokal na pamahalaan na po ang siyang magdideklara at magka-classify kung ano yung mga barangay na matataas pa po ang kaso ng COVID para po masubject pa to ECQ. Kinakailangan po yung classification at pagtatalaga at pag-identify ng LGU ay gawin pursuant to a confirmation to be made by the Regional Interagency Task Force.
According to the palace official, the IATF will finalize the list of industries that may reopen in MECQ areas. Meanwhile, areas low risk for COVID-19 will no longer be under community quarantine starting May 16. On the other hand, general community quarantine will be placed in moderate risk areas until May 31. But residents in low and moderate risk areas must continue to observe the minimum health standards. That means social distancing, good hygiene, and proper cough etiquette, among others.
At mayroon tayong mga tawag niyang new normal. Ganito ha, for those who would be allowed to go out and work and for those na hindi pa talaga pwede, remember na itong the easing up of the restrictions, hindi yan sabihin na wala na ang COVID. Just because we allowed certain people, dahan-dahan lang sa para walang hindi tayo madapa, dahan-dahan lang. Because we cannot afford a second or third wave na mangyari.
The government maintains its advice to stay at home for people with no important matters to deal with outdoors. The aim is to minimize physical contact among citizens to slow down the spread of the killer virus. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
The country's health department continues to call on the public to play each one's role in slowing the transmission of SARS-CoV-2, the virus that causes coronavirus disease 2019. One basis that experts use for their recommendation to the IATF is case doubling time. Aiko Miguel explains why.
When giving their recommendation to the national government on the ECQ, one of the bases of experts is the doubling time of COVID-19 transmission. Secondly, they have also considered the critical care utilization of the capacity of the health systems in regions and cities. Based on these health considerations, they have identified what areas are low risk, moderate risk, and high risk with regard to the contagion. In low risk areas, people will have to follow the minimum health standards. Experts say that low risks have case doubling time of 30 days or more. On the other hand, places where it takes 7 to 30 days before the number of their coronavirus cases double are identified as moderate risk. That's different from high-risk areas where the case doubling time is less than 7 days.
Ang importante po sa atin lahat ngayon ay maipatupad natin ang ating mga minimum health standards para po kung sakasakaling tayo po ay mag-transition na nga po dito sa ating pagre-relax ng ating mga quarantine measures for the community, ay maaari po tayo makaagapay without increasing infection.
The Department of Health calls on the public to cooperate and understand the present situation in the country. Everyone must play their part to help prevent the doubling of cases and buy time to treat patients so that our healthcare workers could help more people recover from the disease, as there is still no cure against COVID-19. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Beginning this midnight, Barangay 156 in Bagong Barrio, Caloocan City will be placed under a total lockdown. This means residents must remain indoors within the lockdown period. Stores, markets, and other establishments will be closed. Joa Anano explains why.
The Caloocan City government has decided to place Barangay 156 in Bagong Barrio due to an increasing number of COVID-19 cases within the community. As of today, there are 24 reported coronavirus cases here. Barangay Chairwoman Marites Go clarifies that in preparation for the 3-day lockdown, they informed their residents so that every household could gear up and prepare their necessities.
Nagkaroon po kami ng announcement sa trumpa. Pinaikot po namin yung aming mga tanod para sabihin po sa kanila at nagbigay din po kami ng mga memorandum.
The Caloocan City Police and the city's Public Safety and Traffic Management Office will monitor all private vehicles going in and out of the barangay.
Para maging safety na rin.
Opo, pabor na pabor. Opo, ako pabor.
During the total lockdown, the City Health Department will conduct massive COVID-19 testing among the residents. The total lockdown in Barangay 156 will end on May 15 at 11:59 p.m. All in all, Caloocan City has reported 258 COVID-19 cases as of today, including 24 deaths and 39 recoveries. Joanna Anano, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, employees in government offices expect one of these 4 work arrangements when your work resumes next week. That could be work from home, or you could be part of the skeleton workforce, a 4-day work week or staggered working hours. Ray Pelayo has more details why.
Government agencies and offices may implement 4 work arrangements beginning May 16, 2020. This is based on the revised interim guidelines issued by the Civil Service Commission. An employee can return to their job in one of the 4 work arrangements for the public sector: work from home, skeleton workforce, 4-day work week, and staggered working hours. Workers below 12 years old and senior citizens are automatically part of the work from home arrangement, while setting a skeleton workforce in place limits the number of workers in the office or workplace. These employees are entitled to hazard and overtime pay and other allowances. A 4-day-a-week work schedule may also be advantageous for some. Shifting best fits staggered working hours. This also limits the number of workers in a work area. Offices must also see to it that vehicles are disinfected. A health status survey and a revision of workplace layout for the implementation of physical distancing must be done. It is a must for employees and officials who will enter the government office premises to wear a face mask and submit to temperature check. Every workplace should make sanitation stations available for use. Ray Pilayo, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippine National Police will continue their conduct of quarantine control points in areas under General Community Quarantine or GCQ. This is according to PNP Directorate for Operations Police Major General Emmanuel Licop during PNP Chief Police General Archie Gamboa in a virtual press briefing this afternoon. Major General Licop added that cops will also be deployed in malls to ensure that physical distancing measures are observed when they reopen.
Tuloy-tuloy yung checkpoints natin. Although siguro mangyari na maging random yung ibang checkpoints dahil sa kakulangan ng tauhan. Magtatalaga rin tayo ng mga tauhan upang ipadala dito sa mga establishments to ensure ang compliance ng mga lalo na yung mga malls na magbubukas.
And speaking of checkpoints, Harleen Delgado is on board the UNTV radio mobile booth. Harleen, good evening. Do you see any checkpoints? Where are you right now?
Good evening, William Jago. We are here in Commonwealth Avenue in Quezon City. There is no checkpoint here at the exact location, but we can see outside some cars and even private vehicles, emergency vehicles, police cars, and even motorcycles and bicycles flying the road. And as we all know, William, earlier the palace has announced that the Metro Manila will be placed under modified enhanced community quarantine starting May 16 until May 31. And as of now, William Jago, we are still waiting for an official announcement from the Department of Transportation whether the omnibus guidelines will apply or they will release a new set of guidelines and protocols for areas that will be placed under modified enhanced community quarantine. Meanwhile, a Philippine senator believes the country is not 100% ready to open up its public transportation amid the coronavirus crisis. In a virtual press briefing, Senator Grace Poe, who chairs the Senate Committee on Public Services, says though plans and safety protocols have been placed by various agencies in the government's transport sector, once the public transport resumes partial operations under the GCQ, its success will greatly depend on its implementation. This is what Senator Grace Poe has to say.
Magkakagulo doon sa mga ibang driver na masasabi, bakit kami wala kaming special permit, hindi kami pwedeng maghanap buhay habang wala pa ang dating ng ayuda. Magkakagulo tayo pagdating sa pilahan, sa MRT, sa LRT, at sa mga bus, at sa mga stasyon ng bus. Dahil kalahati lang or 30% lang ang pwedeng ipuno ng mga sasakyan na yon. Kaya doon talaga sa tingin ko magkakagulo.
That is why the lady senator is appealing to companies and even government agencies to maximize the work-from-home arrangement for its employees whose work can be done or performed at home. In the committee's hearing last Monday, the Land Transportation, Franchising and Regulatory Boards, or LTFRB, said over 2 million commuters are expected to use the public transportation under the GCQ.
Kung hindi kailangan pumasok ng mga empleyado ninyo at pwedeng magtrabaho sa kanilang mga tahanan, huwag nang papasukin. Yung mga pinapangako na pagpapatayo ng mga cell towers para yung transmission ng signal mas magaan, mas mabilis, payagan na natin at gawin na natin para mas madaling magtrabaho mula sa bahay.
Meanwhile, a technical working group will be formed by the Senate committee together with the Department of Transportation, LTFRB, and the Department of Social Welfare and Development to speed up the distribution of cash aid to affected public utility vehicle or PUV drivers. LTFRB Chairman Martin Delgado III also noted during the hearing that the distribution process is slow. The Department of Transportation said that the LTFRB initially submitted a list of 390,000 public PUV drivers to the DSWD for the Social Amelioration Program. However, after its validation process, only 90,000 made it to the DSWD's final list. And based on the President's report to Congress, there were 40,000 Transport Network Vehicle Service or TNVS and PUV drivers who have received the cash subsidy.
Kawawa yung mga drivers talaga natin dyan kasi either mawawalan sila ng trabaho, nawala na sila ng trabaho, wala pa silang ibang ayuda na natatanggap.
The DOTR earlier said it has submitted a stimulus package proposal to the Interagency Task Force, which includes fuel subsidy for transport operators. Some taxi and TNVS drivers in Metro Manila are all set to hit the road again, but their worry is getting infected with coronavirus when they resume their operations. Asher Cadapan Jr. tells us why.
Some taxi and transport network vehicle service or TNVS units have installed plastic barriers on the driver's seat of their vehicles. This is in accordance with the protocols of general community quarantine when it is implemented in Metro Manila. Despite the safety measures, drivers are hesitant to resume their operation in fear of being infected with COVID-19 from passengers who may be carriers of the disease.
Aircon kasi, so hindi makalabas ang ng tao. Dahil ang aircon paikot-ikot na, nasa loob, kulog yun eh. Mas okay pa siguro kung walang aircon kasi yung hangin nakakalabas.
Taxi and TNVS drivers explain they may refuse passengers who do not wear a face mask even while inside the vehicle.
Mandatory required po namin sa mga pasahero, dapat po nakamas. Pag hindi po sila nakamas, automatically po hindi po namin pasasakayin.
Some drivers, on the other hand, plan to resume their operation only after all the community quarantine protocols are lifted. Asher Cadapan Jr., UNTV News and Rescue. We serve the people. We give glory to God.
Now let's take a closer look at the updated tally of the coronavirus cases around the world. The COVID-19 pandemic has now reached a total of over 4,193,000 confirmed cases in 187 countries, regions, and sovereignty. The fast-spreading disease has claimed more than 286,000 lives. 1,463,826 patients across the globe have recovered from the coronavirus infection based on data. The United States of America remains to have the most confirmed cases in the world with nearly 1,348,000, including over 232,000 deaths. Russia has surging cases, but its government has ordered the gradual easing of lockdowns. It's now the second worst hit country with more than 232,000 known cases. Now looking at the available data, India has soaring cases. In fact, it's in the top 12 countries with the highest number of known COVID-19 positives. As of today, India has 71,339 cases, including 2,310 deaths. Canada follows in the 13th place. Meanwhile, the Philippines Department of Health reported today that as of 4 p.m., 264 new cases have been recorded, bringing the total confirmed cases in the country to 11,350. We have lost 25 more patients. Now the country's death toll stands at 751. With the help of our valiant medical frontliners, 107 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 2,106.
4.9 million more households may receive cash assistance from the government through the second tranche of the Social Amelioration Program. One option to receive this cash aid is through electronic devices. Leia Ilagan has more details. Why?
Distributing the second tranche of Social Amelioration Program Fund before the end of the month. That's the Department of the Interior and Local Government's target. The ILG Undersecretary Jonathan Malaya says that for the second tranche of SAP cash assistance, 4.9 million families left out in the first tranche will already be included.
Yung mga left out families, yun naman ang isasama natin sa second tranche. So pag natanggap na ng mga original beneficiaries yung kanilang second tranche, ay doon natin isasama yung mga second tranche naman.
He explains they are just waiting for local government's liquidation report on the first tranche of assistance and then the Social Welfare Department's validation.
Ibig sabihin yung mga debit card na yan, yung mga paymayang yan, pwede na pong gamitin, no? Kasi ginamit actually natin yan for the 4Ps. No? At naging matagumpay yung 4Ps dahil 3 days na bigyan natin lahat ng almost 4 million na 4Ps beneficiaries.
Only 91% of the total SAP beneficiaries received the cash and during the first tranche of SAP fund before the May 10 deadline. And of the 1,623 local governments, only 1,265 completed the distribution process. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippine National Police launched today the Camp at Us project for stranded students in Manila. This benefits hundreds of students. Let's find out why from the exclusive report from Asher Kadapan Jr.
The Police Community Affairs and Development Group has created the Kalinga sa Mag-aaral, Alay ng Police at Your Service or Camp at Us to bring relief and transport to respective provinces hundreds of stranded students in Metro Manila. They visited and extended relief packs to about 200 students from the Polytechnic University of the Philippines or PUP in Santa Mesa, Manila today.
Dito sa PUP, meron silang almost 200, 190 plus. Sa UP Diliman, nung nakaraan, 256 ang unang sabi noon. Pero may naihatid ng iba. May natitira pa doon na mga more than 200. Sa UP Los Baños din, ganun din, halos ganun din karami. Although may naihatid na rin ng AFP noong una, marami pa rin naiwan doon.
According to PUP President Dr. Manuel Muhi, these students have been staying in dormitories in the vicinity of PUP since the enhanced community quarantine was implemented in Luzon region.
The students right now are preparing for the summer class, no? Kung meron silang klase. Yung iba talaga nakabakasyon na. Kaya yung iba gusto na talagang umuwi dahil wala nga silang ginagawa sa kanilang mga boarding house.
Some students explain they have also been wanting to go home but fear they might bring to their families the contagious disease, so they might as well stay in Metro Manila.
Baka matakot din po yung mga pamilya namin sa galing sa probinsya kasi nga po nandito po kami sa Maynila, which is ito nga po, itong Manila po ang pinaka high risk po sa virus.
Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
President Rodrigo Duterte ensures the government will assist students stranded in Metro Manila. According to Malacanang, this is through the Hatid Estudyante program. Through this new program, the government will provide the transportation, food during the trip, and allowance of students going back to their provinces. These students are affected by the travel restrictions and quarantine measures imposed in the National Capital Region or NCR. However, these students are expected to go back to Metro Manila once the situation improves for them to finish their studies. Let's listen to what Presidential Spokesperson Secretary Harry Roque says about the program.
Uuwi po ng presidente natin ng mga estudyante sa pamamagitan ng riles, barko, bus, at eroplano. Magbibigay po ang presidente ng konting ayuda sa kanila para makauwi. Sapat po ito para sa pamasahe.
The World Health Organization warns against the use of herd immunity in fighting the coronavirus pandemic. A WHO executive director calls it a dangerous calculation. Kath Dumaraos tells us why.
The World Health Organization, during Monday's regular press briefing in Geneva, warned against the use of herd immunity to combat COVID-19. The WHO calls it a dangerous concept in the absence of an effective vaccine, underscoring it does not protect the more vulnerable people in society. Michael Ryan, executive director of the organization's Health Emergencies Program, said that responsible states should do their best to protect all people.
Humans are not herds. And as such, the concept of herd immunity is generally reserved for calculating how many people would need to be vaccinated in a population in order to generate that same effect. So I think we need to be really careful when we use terms in this way around natural infections in humans.
Dr. Ryan emphasized that no one is safe until everyone is safe, stressing the pandemic has left the world in a terrible state where in some places vulnerable people and healthcare workers are not properly protected.
This is a really dangerous calculation, and not one I believe most member states are willing to make that arithmetic. Member states, responsible member states, will look at all their population. They value every member of their society, and they try to do everything possible to protect health, while at the same time, obviously, protecting society, protecting economy, and other things.
Technical lead of the Health Emergencies Program, Maria Van Kerkhove, also noted during the press conference that the number of people who were tested of having the evidence of antibodies are quite small, saying the range is between 1 and 10%. Kat Dumaraos, UNTV News and Rescue. We serve the people, we give glory to God.
It has been a question by many. Does hate kill coronaviruses? What about the rain? Can the rainy season affect the rate of coronavirus transmission? It's been raining nowadays, and people ask what's the effect of the wet weather on the coronavirus outbreak. Our correspondent Ray Pelayo talked with Dr. Anthony Leachon, the COVID-19 Special Medical Advisor to the IATF, who said that there might actually be an increase in COVID-19 cases. Here's Ray to tell us why.
Most likely, magkakaroon ng increased cases ng COVID cases.
This is the scenario projected by COVID-19 National Task Force Special Advisor Dr. Anthony Leachon for a possible outcome of COVID-19 cases during the rainy season.
Pagka tag-ulat kasi, pinipredict natin dahil dikit-dikit, it will cause more problems kasi yung social distancing mawawala. Diba? Pag tag-ulan.
According to Dr. Leachon, there is no concrete evidence that weather affects coronavirus transmission. Infections course through close contacts with a carrier of the disease. He emphasizes that individuals evacuated to safety from flooding and the wrath of typhoons must strictly observe physical distancing aside from hand hygiene.
Kunyari mag-evacuation center ka, dapat may mask at may alcohol doon, tapos malalayo kayo.
Meanwhile, the National Disaster Risk Reduction and Management Council says that observing COVID-19 protocols is included in their preparations, and the RRMC spokesperson Mark Timbal explains they will separate sick persons in evacuation centers from those who are not. Health officials will make sure to monitor evacuation areas during the tropical cyclone. Dr. Leachon also says the government is ready to face dengue cases.
I-prepare nyo ng kabahayan nyo na wala masyadong papasok na mo. Dadakay ng mga repellent at mga damit na mahaba para hindi kayo makagat ng lamok.
Leachon advises the public to stay at home even during the rainy season, especially if there is no important activity outdoors. Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine government has reached its 8,000 target testing capacity in a day, according to updates from the Health Department. However, this was done 10 days after the target date. Aiko Miguel details why.
The health department is certain that the country's testing capacity can still elevate and reach its target, despite hindrances and challenges along the way. Yesterday, Health Undersecretary Maria Rosario Vergere reported that the Philippines has reached its 8,000 target daily testing capacity, but this target was met 10 days after the target date of April 30. The DOH still has to reach the 30,000 target tests a day before the month ends. But according to Malacanang, this can be accomplished only with more licensed testing laboratories in the country. At present, there are only 26 licensed testing laboratories.
Ang katotohanan po, we need around 70 laboratories to reach 30,000 a day. We will get there by hook or by crook. It is the only way po na malaman natin kung nasaan na ang ating kalaban.
A high testing capacity means a wider scope of contact tracing. Isolating and treating COVID-19 patients, or what the government calls the T3 COVID-19 response, that is test, trace, and treat, are very important to prevent further COVID-19 transmission in the country. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The national government is inching closer and closer to its target number of COVID-19 tests per day beginning next month. The health department enjoins local government units to also increase their testing capacities. Dante Amento tells us why.
The government can now conduct 8,000 tests for COVID-19 per day, although Health Secretary Francisco Duque III says this is still far from their targeted 28,000 tests per day by next month. The DOH urged local government units to strengthen their mass testing capabilities.
Once we are able to do that, it will help us to detect early. And because we are able to detect early, we can manage cases of COVID more quickly.
Duque adds, even though some laboratories are applying for accreditation, they cannot just simply grant it. The DOH is very strict when it comes to proficiency tests. This is to avoid false test result, which in turn might lead to further transmission of the disease. This morning, Duque visited a swab testing center in San Juan City Gym, which prioritizes frontliners for the swabbing. Dante Amento, UNTV News and Rescue. We serve the people. We give glory to God.
73 more police officers are in quarantine. They are cops who had close physical contact with 13 officials and personnel of the Quezon City Police District diagnosed with COVID-19. National Capital Police Region Office Director of Police Major General Debold Sinas explains that they are also monitoring the contacts of 3 other COVID-19 positive policemen in community precincts at police stations 2 and 3. They are also supervising the swab tests on those cops, General Sinas said. The NCRPO chief also disclosed that 13 QCPD members positive for coronavirus are asymptomatic. They remain inside PNP quarantine facilities. Within the NCRPO, 53 police officers have tested positive for COVID-19 as of today. 11 of them have recovered. Of those recoveries, 4 have returned to their post. The rest continue to undergo treatment. Online court hearings have resulted in more and more persons deprived of liberty walking out of jail through expedited processes. In fact, 183 PDLs in Zamboanga City's Reformatory Center await release this week. The Supreme Court has earlier directed the release of qualified inmates with the objective to decongest prisons and in turn prevent COVID-19 transmission. 60 other individuals were freed last week. They are now in quarantine inside a private facility and awaiting swab test results. Attorney Kenneth Beldua, the city secretary, explained they were set free after either serving the minimum period of their sentence or having a plea deal. Presently, 53 inmates and 9 jail personnel in the city Reformatory Center have tested positive for coronavirus infection, according to jail authorities. Elsewhere in Occidental Mindoro, persons deprived of liberty in the district jail has a way to communicate with their loved ones despite the jail lockdown. PDLs in the San Jose District Jail can use computers to see and talk with their loved ones virtually through live video calls. A district jail officer explained that through video conferencing, inmates and jail personnel could avoid physical contact with persons coming from outside the facility, which houses more than 100 detainees. The Bureau of Corrections has ordered the lockdown in all prison facilities across the province. Meanwhile, detainees here also continue to sew face masks. Through this activity, not only do they have face covering for protection from respiratory droplets, but also have something to pass the time with, since other activities inside the prison have been canceled. The San Jose District Jail remains COVID-19 free. President Rodrigo Duterte offers a 2 million peso bounty for the arrest of New People's Army top leaders. The announcement was made during his meeting with the IATF against COVID-19. The chief executive also promises informant security and livelihood. This after attacks of NPA against government forces that assist in the government's response against the COVID-19 pandemic. Let's listen to President Rodrigo Duterte.
2 million ang basta yung top commander. 1 million yung mga ganun. I think 2 million. Yeah. Was it 2 million? Yes, sir. Kung sino yung makaturo tapos doon sa Army o Police. So, pag ikaw ang nagturo, natuhuli yung commander na mabigat, may hati ka dyan sa pera. Pero alisin kita sa lugar mo. Kung taga-Abra ka, ihatid kita sa Mindanao, doon sa mga Ilocano. Bigyan kita lupa, doon ka na lang.
Senator Grace Poe announced Senator Sherwin Gatchalian will lead the Senate committee hearings on bills related to the ABS-CBN franchise. The lady senator who chairs the Senate Committee on Public Services has inhibited from the hearing. Instead, she has Senator Gatchalian, who is one of the committee's vice chairperson. The committee is expected to tackle Senate Bill 1521, filed by 13 of her colleagues, which seeks to grant a provisional franchise to the media network until June 2022.
Hindi naman siguro makakasama na i-extend ng maikling panahon para mapag-aralan ang bill na ito ng franchise, kung karapat-dapat ba na i-extend ng 25 years pa. Tapos, ang serbisyo ng pagbibigay ng impormasyon at aliw or entertainment ay tuloy pa rin.
Meanwhile, lawmakers have varying opinions on the passage of the Corporate Income Tax and Incentives Rationalization Act, or CITIRA. According to some, the government must first help businesses to resume so government can collect taxes. But for other lawmakers, this is a good opportunity to persuade foreign investors in the country. Vincent Arboleda will tell us why.
There are different opinions from lawmakers after Finance Secretary Carlos Dominguez requested Congress to pass the Corporate Income Tax and Incentives Rationalization Act, or CITIRA, before June 3. According to Marikina 2nd District Representative Stella Kimbo, with some business establishments struggling and facing closure due to the COVID-19 crisis, government should give more importance to ensuring that these businesses continue. Hence, instead of passing CITIRA now, Congress should prioritize passing the economic stimulus package to kickstart the country's economy. The economic stimulus package aims to help small and medium enterprises continue their business, thereby ensuring that no Filipino will lose their job.
So kailangan natin munang i-ensure na magtuloy-tuloy yung mga negosyo nang sa ganon meron din tayong itatax, di ba? So dapat ang usaping tax sana should come ideally after economic stimulus.
As for Senator Grace Poe, this is not the right time to pass the SITIRA.
So with SITIRA, we are actually taking out the benefits or the exemptions or incentives for these companies, yung mga BPO or dun sa mga PEZA zones. So it will be hard for us to catch those investments.
Instead of passing tax measures, Senator Kiko Pangilinan asks the economic team to look into borrowing for the economy to recover. But there are also lawmakers who think otherwise and that now is the best time to pass SITIRA. Albay 2nd District Representative Joey Salceda says lowering corporate income tax through SITIRA from 30% to 25% this 2020 will help persuade foreign investors to invest in the country. Salceda says SITIRA will also help provinces to develop as investors may find it more attractive to put up their companies in provinces due to the double incentives that they may receive. Ako Bicol Party List Representative Alfredo Garbin Jr. and Kabayan Party List Representative Ron Salo also share the same idea that SITIRA will help persuade foreign investors to the country. The Corporate Income Tax and Incentives Rationalization Act or SITIRA has been passed by the House of Representatives last 2019. The bill is currently in the Senate and awaiting the decision of the senators after the Finance Secretary made the request of its passage before the session takes a break this June. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
The total number of COVID-19 cases among Filipinos abroad went over the 2,200 mark today. According to the Department of Foreign Affairs or DFA, 38 new confirmed cases were reported, while 25 more recovered. But one new death was recorded in the Asia and the Pacific, Europe, and the Middle East. No new reports were received from the Americas. Based on the figures from the DFA, the total number of Filipinos who recovered from COVID-19, which is now at 669, remains more than twice than that of total fatalities. That is almost 30% of total confirmed cases in Filipinos abroad. And as of 3 p.m. today, the center of tropical depression Ambo was estimated based on all available data at 410 kilometers east of Surigao City, Surigao del Norte. It has maximum sustained winds of 55 kilometers per hour near the center and gustiness of up to 7 kilometers per hour. It is moving north-northeast slowly. Tropical cyclone wind signal number 1 may be raised over portions of eastern Visayas today in anticipation of potentially strong winds associated with the tropical depression. Tropical depression Ambo is forecast to intensify into a tropical storm within 24 hours. Based on Pagasa's forecast, Mindanao and eastern Visayas will experience cloudy skies with scattered rain showers and thunderstorms due to Ambo's trough. Metro Manila and the rest of the country will experience partly cloudy to cloudy skies with isolated rain showers. And for the news abroad, here's Stephanie C. live from Hong Kong. Stephanie, good evening. How are you?
Good evening, William, and of course to Diego and Harleen. The Hong Kong government expresses deep concern and strongly urges underage persons to stay away from high-risk protests and stop participating in any news reporting activities at scenes of protests. A government spokesman explains that underage persons are easily influenced by other people to defy the law or take part in high-risk events. The spokesman also stresses that protests and acts of violence have taken place in various districts again recently, adding that young people have less life experience and may be easily incited to commit crimes they may not know the serious consequences of breaking the law. This comes in response to an incident in which underage persons claimed that they were conducting news reporting activities at a protest in Tsim Sha Tsui on May 10. South Korean authorities said today they are combing through cell phone data, credit card statements, and CCTV footage to identify people who visited a number of Seoul nightclubs at the center of one of the city's largest coronavirus outbreaks. Eric Ferrer has the story why.
South Korean President Moon Jae-in called for a prompt action in a cabinet meeting earlier today to empower the Korea Centers for Disease Control and Prevention, or KCDC, to fight the coronavirus pandemic.
We cannot afford to hesitate while looking at a crisis in front of us. We need to urgently reinforce the quarantine and the health system.
Officials reported 27 new coronavirus infections across the country as of midnight on Monday, May 11. That was the fifth day of a double-digit increases after the first case at the nightclubs was revealed last week. Authorities have obtained a list of more than 5,500 individuals who had patronized the night destinations. The government is also working on identifying them. The KCDC said today that at least 93 people have tested positive in connection with a cluster of cases linked to nightclubs and bars in Seoul's popular multicultural neighborhood, Itaewon. Authorities said a 29-year-old man who resides in Yongin City, Gyeonggi Province, visited a total of 6 clubs and bars in Itaewon from May 1 to the early hours of May 2. He tested positive for COVID-19 and was admitted to a hospital on May 6. The Seoul government on Saturday ordered all entertainment spots, such as clubs and bars, to halt business amid growing worry about the cluster infections. Eric Ferrer, UNTV News and Rescue. We serve the people, we give glory to God.
Dubai's 828-meter Burj Khalifa has become a glowing charity donation box to buy food for residents of the United Arab Emirates suffering from the economic impact of the new coronavirus pandemic. Each of the tower's 1.2 million lights can be bought for 10 dirhams to buy one meal. People could bid the claim to light the light at the very top. The donation box has raised funds for more than 1.2 million meals so far. The UAE has recorded almost 19,000 cases of infection with COVID-19 and 201 deaths, the second highest death toll after Saudi Arabia of the 6 Gulf states. And now let me tell you more about the acts of kindness in Thailand. Just like back there in the Philippines and many other countries, the pandemic has brought out a lot of good in a lot of people. From canned food, instant noodles to bag of potatoes, communal free food pantries have been sprouting up like mushrooms right there in Bangkok. The so-called pantry of sharing helps those in need with small pantry cabinets in community areas constantly filled with food and necessity items, and that's all up for grabs. Family members, even kids, drop by with their parents to pick up supply, while others fill up the pantry with food, bottled drinks, rice grains, soap bars, and tissue rolls. Within days, similar food pantries sprouted up with over 150 cabinets in 44 provinces across Thailand, according to the movement initiator Supakit Kolchart Vijit. He explained that the project was inspired from the Little Free Pantry in the United States. Although the Thai government have eased some restrictions allowing some businesses to resume work after the number of confirmed cases dropped to single digits in the past week, most of the Thai workforce remains out of job and cash-strapped. Those who pick up goods say they don't want to take a lot of because they should also share with others, so they can only take what they need. And those are the reasons behind the news here in Hong Kong and other parts of the globe. Good evening, everyone. Back to you, William.
Thank you, Stephanie C., reporting live from Hong Kong. You stay safe over there.
During health crises and pandemics, the world witnesses the efforts and sacrifices of our health workers. 2020 is the International Year of the Nurse and the Midwife. And as Health for All is one of WHO's big campaigns to have universal health coverage and access to quality care everywhere for everybody. Today, dozens of pre-selected films out of nearly 1,300 submissions will vie for the Grand Prix in 3 categories that focus on health issues and health workers. Nina Arbillo has more details why.
The World Health Organization stages its inaugural Health for All Film Festival today, May 12, at 5:30 p.m. Geneva time. That's 11:30 tonight here in Manila. WHO has received 1,265 entries from 119 countries. I talked with Jill Rubo a day before the event. He's the film festival leader from the WHO Audiovisual Team, Department of Communication.
With a goal of paying tribute to all champions of health and also encouraging filmmakers, whether they are good amateurs or professional filmmakers, to speak more about health issues in the world.
He said entries focused on a wide range of topics, such as the challenges of providing healthcare in remote areas and countries in conflict, and realities of living and battling diseases, and the courage and resilience of nurses and midwives in the face of the most challenging of circumstances. There are 3 categories: video reports, animation films, and videos centered on nurses and/or midwives. Only short films completed between January 27 and January 2020 are eligible for the Film Fest.
Audiovisual language is really a strong universal language nowadays, accessible to so many persons.
Even if people cannot come physically, the virtual awarding ceremony will push through.
The WHO Director General will announce 5 winners. For every category, there is a Grand Prix. We use a French word, Grand Prix, for the main prize. In addition, we have a student prize for film made by students. We decided to also offer a special prize for a film about NCDs, as we call them for short, for non-communicable diseases.
The festival's concept designer hopes that more and more people will be encouraged to produce films that tackle health issues. Ribot added the time of lockdowns and stay-at-home orders could actually be used fruitfully by creating audiovisual presentations such as those that tackle health issues. WHO Director General Tedros Adhanom Ghebreyesus said he is incredibly encouraged by the appetite of filmmakers. The Film Fest will be streamed live on WHO YouTube channel and in other WHO social media channels. And the in-person Health for All Film Festival is planned to take place on October 22 to 24 this year in Geneva, Switzerland. Nina Armilio, UNTV News and Rescue. We serve the people. We give glory to God.
Our Kasangbahay, we are at a time when the country is under a state of health emergency. The cooperation of all Filipinos is imperative to avoid the further spread of the deadly virus.
We are calling on everyone to be calm and, most importantly, let us join together in prayer for our country and for the whole world to survive this crisis.
You may join us in our daily UNTV community prayer at these hours as flashed on your screens. And those are the reasons behind the news. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I am William Theo. We serve the people. We give glory to God.
And I am Angelo Castro III. Because we need to know, we will always ask why.